Dr. Phil Chan is here, our Rhode Island Department of Health Consultant Medical Director and lead in terms of our vaccine response with reporting out what's been going on. And we are also joined by Director Brett Smiley from the Rhode Island Department of Administration. Like we usually do, I'll start by giving an overview of our numbers and a few general updates. As you can see on our dashboard, and as Dr. Chan will explain in more detail, 63,152 doses of COVID-19 vaccine have been administered in Rhode Island to date, and 12,515 people have been fully immunized, first and second doses. As I've outlined before, ordering, receiving, distributing and redistributing, storing, and administering vaccine is a very complex process. But the systems we have in place here in Rhode Island are strong and they are working well. We are only getting very limited amounts of vaccine right now, like all other states, but we continue to be in the top tier nationally in terms of doses administered per capita. We have a huge team of folks across the state who are engaged and ready once we get additional vaccine to really be able to accelerate what we need to in getting as much of our population vaccinated as possible. So thank you to all of the individuals that are involved. We are administering the doses that we have in a way that will have the greatest impact on the health of our state, and with a deliberate focus on equity. Equity, fairness, and transparency have been priorities for us throughout, and they will remain priorities going forward. It's our role to continue to share the basis for that, what we are thinking, and help you understand what's needed to keep everyone as safe as possible. Dr. Chan is going to provide some more detailed updates on where we stand in our vaccination campaign, but I wanted to share that we have started to send out a weekly COVID-19 vaccine update. If you want to get the latest on our vaccination campaign, you can go to c19vaccineri.org to sign up. In terms of our case data, we had 698 new cases yesterday of 20,079 tests. That's a percent positivity for yesterday of 3.5%. And our weekly percent positive is 5%. So right at the threshold that we have set. That 3.5% positive number is great news. Not so great news, sadly, we have 18 new fatalities to report, which brings our total for COVID-19 associated fatalities to 2,076. Of these new COVID-19 fatalities, 2 of the individuals were in their 50s, 2 were in their 60s, 4 people were in their 70s, 7 individuals were in their 80s, and 3 were in their 90s. Our condolences and our hearts go out to the families of these precious Rhode Islanders who we have lost. While I always report our fatality data with an extremely heavy heart, our case data is a little more promising. After we saw a peak in early December, our percent positivity and hospitalization numbers have all generally been decreasing slowly and steadily. The last time that our weekly percent positive was at that 5% mark was all the way back in the first week of November. If you recall, right before we started our pause at the start of December, our percent positive was almost double what it is now, close to 10%. These trends and the fact that more and more vaccine is slowly but steadily getting administered every day in Rhode Island, our signs are all going in the right direction. However, COVID-19 is not going away tomorrow. As much as we would like it to, it is not. We do have the tools to be able to handle it. We are all going to need to continue taking measures to prevent the spread of this virus even after we have been vaccinated. COVID-19 vaccine is extremely effective at protecting you from developing symptoms of COVID-19. For our most at-risk populations, this means, and this is our key, that it will be extremely effective at preventing people from being hospitalized and from passing away from COVID-19. This is great. This is what our focus is. We want to prevent hospitalizations and we want to keep people alive. This also allows us to protect our healthcare system capacity, which we need to be able to ensure is in place. Obviously, every one of us wants to prevent any more loss of life. And as a second key consideration, keeping hospitalizations low is critical to our ability to managing this pandemic. At the same time, an outstanding question is whether the vaccine will prevent infection completely and prevent you from spreading it to another person, even if you yourself don't actually experience any symptoms of COVID-19. Now, that's a complicated concept to understand regarding the vaccine, so I want to really talk about this further. While the vaccine will prevent most people from getting very sick from COVID-19 and ultimately from going to the hospital or from dying, we still don't know for certain that it will totally prevent you from actually getting the virus or from spreading coronavirus. Because you could still get COVID-19 even after you've had the vaccine, not have any symptoms, but you could still get it and potentially spread it to others, you need to continue to wear your mask, watch your distance around anyone you don't live with, wash your hands regularly, and continue to be vigilant in the ways that we've talked about, even after you get vaccinated. Another key component with that is, as of right now, nothing changes with quarantine and isolation. If you've been vaccinated and test positive for COVID-19, you must still isolate. If you've been vaccinated and are a close contact of someone who tested positive or have recently traveled to another state with a high positivity rate, you must still quarantine. If you have symptoms of COVID-19, you should isolate at home, call your healthcare provider, and get tested for COVID-19, whether or not you have received the vaccine. Testing is more available now than it ever has been in Rhode Island. If you go online right now to portal.ri.gov, you can make a same-day appointment to get tested at many sites throughout the state. It's a real tribute to how hard the team has been working across the board and really the effective improvements that have been made time and time again. And it explains why Rhode Island is leading in terms of testing in our COVID response. We have a few new testing sites continuing to open on a regular basis, including this week. For example, just today, 2 new sites are opening. One is at the Knights of Columbus Hall on Valley Road in Middletown. This site will be open 7 days a week from 9 a.m. to 5 p.m. and can handle 500 appointments a day to get tested. In Woonsocket, a testing site is also opening today at Thundermist on Clinton Street. A K through 12 testing site is already operating there, but there is space for general public testing now 7 days a week from 8:30 a.m. to 4 p.m. This site also has capacity for an additional 500 tests a day. For both sites and for the 14 other sites throughout the state, you make an appointment at portal.ri.gov. It's fast, it's easy, and it's free. I'm continuing to get tested regularly, and I urge all Rhode Islanders to think about regularly getting tested for COVID-19. This is especially important with the newer strain of COVID-19 identified in our neighboring states. Although we are doing a systematic process to identify it via our state health laboratory here in Rhode Island and have not seen it as of yet, we know that because of its presence in our region, in our neighboring states, it is a matter of time. Being able to use the tools that we have prepared for you, getting tested regularly, accessing the treatment, wearing your mask continually, particularly when you're with someone that you don't live with, washing your hands, keeping your distance, all of those measures work effectively for the new strain, which is considered to be even more transmissible. It may spread more easily. However, being able to get tested, get treatment if you are positive and have symptoms, wear your mask, distance, and wash your hands can still help prevent you from getting exposed to the new strain. Unfortunately, we don't have enough vaccine right now for every Rhode Islander. No state does for any of their residents. And treatment is something that is available, and we really encourage everyone to access it, but it is available for those who test positive and have symptoms and have the qualifications. So if you test positive and have symptoms, find out from your healthcare provider if you're 65 years of age and older or you have some underlying illness, get access to the treatment because it is there for you and is an excellent tool to help keep you out of the hospital. But testing is something that is available for every Rhode Islander. It doesn't require you to be a certain age. You don't have to wait for a particular time. It is accessible, and we urge that you take advantage of the testing capacity that we have in the state. It's a way to keep yourself healthy and safe, and it's a way to protect your household. Before passing things to Dr. Chan, I want to thank everyone, to pause a minute and to really just thank everyone. It's been a very long 10 months. We've all learned a lot. Crisis is a very powerful teacher. One thing that I've seen and learned time and time again is that we do so much better when we come together and support each other. We all want to get vaccinated as quickly as possible. And believe me, we all want to vaccinate everyone as quickly as possible. We all want to be healthy and safe and to keep our loved ones healthy and safe and to get COVID-19 behind us. We are getting there, but it is taking time. And we want to thank everyone for your patience, for your sacrifice, and your focus on working with us to get to this point. We need to keep it going for a little while longer. As Dr. Chan has said, this is the beginning of the end of our pandemic response, and we need to remember that we're all in this together. So please, let's keep supporting each other as we hear about supply that we have. We want to get it to them first. Those who are at much lower risk of actually having to go to the hospital or dying from COVID, even though they may be exposed to it, use the tools that we have. Getting tested regularly, wearing your mask, social distancing, knowing that you have the capacity in your hands to stop transmission, and the vaccine can be reserved for those who are at higher risk of going to the hospital or dying if they were to be infected with COVID-19. We can do this, we can support each other, and be selfless in helping to ensure that those most vulnerable get taken care of first in Rhode Island.